A very good morning to you. I'm Howard Feldman. This is the Synthesis Sunday podcast. It is the 22nd of November, which means that this is the penultimate recording for the year 2020. That is, unless something dramatic happens and Dr. Meyberg and I will get together for some form of I don't want to say emergency update, but let me call it an emergency update. So either way, it is today and it is next week, Sunday. After that, we'll be taking a break until January, where we will update further on the situation with regard to COVID. So if you do have any questions, next week is your last opportunity to send them in. Dr. Meyberg, a very good morning to you. I see that there's been a little bit of an uptick, people panicking about certain areas in South Africa, the Western Cape, Garden Route, etc. We'll get onto that in a short while, but can you just give us a sense of where we're at?
Good morning, everybody, on this very chilly and rainy morning in Gauteng. There currently are 58,536,900 cases worldwide, with 1,387,179 deaths and 40 million cases resolved. The United States has 12.4 million cases with 261,000 deaths, and South Africa has 765,409 cases with 20,845 deaths and 2,646 new cases in the last 24 hours, the recovery rate being 92.5%. There are currently 1,607 cases in hospitals in Gauteng, with 158 in ICU and 73 being ventilated. The Eastern Cape has 1,254 cases admitted in hospital, with 61 in ICU and 52 being ventilated. The Eastern Cape has gone up over 30% in the last 10 days, Western Cape over 10%, and Gauteng and KwaZulu-Natal have gone up over 5%.
So at this stage, the Gauteng-Natal area, KwaZulu-Natal area, still lagging a little bit behind the Eastern and the Western Cape.
Correct, for now.
Right, and a lot of people have sent in questions. People are looking now, as we said, it's the end of November. December is a time that people are traveling. They are going to KwaZulu-Natal. They're going to both Eastern and Western Cape. They're going to the Garden Route. What is your concern, or what is your thought around that? Some people saying, we've booked to go to Plet, should we be cancelling?
So I think it's all part of being responsible. Everyone needs a holiday. Everyone needs to go away. Everyone needs time just for R&R. If you're going to go away and stay in the house or stay in the place where you're staying with yourselves or just one family, that's responsible, that's reasonable. Once you start entertaining, or once you start going out to clubs or to bars or anything in that vein, that's irresponsible. And that's a very much higher chance of you spreading or getting the virus. If you're going to go away and you're going to make sure that you can do online shopping and can stay away from the shops as much as possible, then it's doable. But if you don't, well, then we're looking for trouble.
So at this stage, your advice is don't think about cancelling, just think about being careful.
At this stage, I'm still going away. As long as we can all be careful and we can just maintain it, then I wouldn't cancel right at this point. As I said, you can go away either by airplane, you can go away by car. Obviously, going by airplane is safe on the airplane. It's not the actual airplane that's a problem. It's the congregating in the hall before and getting onto the plane. And maybe one of the things you can do is also wipe down your seat before you get on the seat. Make sure you keep your mask on. Make sure you keep your visor on the airplane throughout the whole duration. Don't eat or drink. Get off the plane. Keep on sanitizing, and that's the safer way to do it.
What are you seeing in your hospital? Because I know last week you said there were no cases.
So we're now sitting on 3 cases, which doesn't sound like a lot, but when you've been going for 2 or 3 weeks with no cases, 3 cases is a lot. And the people are sick at the moment.
And are you seeing it? Are you seeing it from specific areas, communities, or is this at this stage is still random?
Still random at the moment, but there is definitely an uptick, as you said earlier.
Can you give us an update on where we are with the vaccine? Because there's been further announcements, different vaccines going to become available.
Multiple vaccines are becoming available. We've discussed the Pfizer vaccine, which is the RNA vaccine. We've discussed the Moderna vaccine, which is also an RNA vaccine, which is also in phase 3 trials, which is also being discussed as being a cold storage vaccine, but one that doesn't have to be kept at such extreme temperatures as the Pfizer vaccine. And I think as the Pfizer vaccine comes out, this will be great, but when the other vaccines come out, they will overtake the Pfizer vaccine, especially because of the accessibility and the ease of storing the vaccines. The other vaccines are the AstraZeneca, the Chadox vaccine, which is not an RNA vaccine, which is made through other means. And this one will also become available and won't have to be stored at -70 degrees. So there are multiple vaccines that are going to be available and going to be able to help us. But we've just got to wait to see exactly how long these vaccines take. Remember, we've always said that the vaccines are very, very important, especially in elderly people with comorbidities who are of the greatest and severest risk in COVID-19. And we want a safe and effective vaccine, which could help in two ways. We want direct protection, where there's high-risk groups are vaccinated to protect them from disease by reducing the susceptibility to disease or infection, or there's indirect protection, where those people who are in contact with high-risk individuals are vaccinated, and they prevent transmission by reducing the number of people infected to the actual virus. The viruses, as you said, are in phase 3 trials, whereas the primary endpoint is of virological confirmation and getting rid of symptomatic disease, and the secondary endpoint is to prevent infection. The most important question we're asking with regards to these vaccines is, do they prevent infection and do they reduce contagiousness? And we don't know if people who have become infected or are transmitted with the vaccine can actually transmit the virus further. There's still lots to learn. There's still a number of months before we see what the outcomes of the vaccines are going to be. So there's still a long journey with regards to the vaccines.
Numbers have been thrown around in terms of the efficacy of the vaccine. What, you don't like a cat? There's nothing wrong with this cat. I feel like you're not a cat person, Anton.
I can't.
All right, so a number of numbers are thrown around in terms of efficacy, 90%, 94%, 95%. Some bright spark said to me, well, you've got a 99% chance of surviving COVID-19. I'll take my chances. Thank you very much.
Well, that bright spark obviously isn't involved in the medical field, because if they were, they would understand what it's all about to see somebody in ICU with COVID-19. So if they want to be part of that percentage of patients that take their chances, good luck to them. We'll see them on the flip side, and please God, we'll get them through it.
Okay, but what does that mean really in terms of 95%? What do we hope for with a vaccine? Is that, I mean, it sounds very high, but is that what we would hope for and expect?
Look, I think it's very similar to also to the antibody, the things.
Sorry, I've got a very badly behaved cat here, but do carry on.
The next thing we'll be treating for will be cat scratch disease, which is a whole different sort of...
I've had it. I've had that.
Every hypochondriac has had that. We know that. Well done to you.
I was confirmed.
Take a number.
I was confirmed having had cat scratch disease. I wanted to know.
Back at the Raj.
Where were we? Yeah.
That people, even people who've had the virus, 30% of them don't get antibodies. We know that. And the same reason that some people who are going to be vaccinated, a small percentage of them won't develop antibodies or won't develop T-cell memory cells to this vaccine. We don't know why, we don't know how. There's always a small percentage or proportion of people that will not react to vaccines, and that's a small amount of people that won't react.
Do you think that there's a possibility that one of these vaccines will work better for us here in South Africa than the others? We have asked the question before, but a lot of people seem to want to know this.
You know, I think we're in an advantage in South Africa, you know, as we've been the whole way through COVID-19. The Northern Hemisphere getting the virus first, them learning how to deal with the virus, us getting the virus at a later stage, us learning from their experiences. So I think with the Northern Hemisphere getting the vaccine first, as we know, we'll be down the feeding chain. We will learn which is the best vaccine for us. We will know that certain vaccines, the same as the influenza vaccine, there's certain strains that are more common in the Northern Hemisphere than they are in the Southern Hemisphere. And it depends on the mutation of the actual virus and the sequence of the genome of the virus, which will be better for us. At this stage, I think everyone's just hanging on the fact that we want a vaccine now. But I think as the months go along, we'll understand which is the better vaccine for us. And we know that we are currently working on trials with the Chadox vaccine. That's with Shabir Mahdi, who's doing that with the AstraZeneca and the Oxford one. And that sounds like it'll be more towards treating people who are immune compromised and people who are able to receive that type of vaccine. So maybe that might be the right one for us, but we'll find out over time, I suppose.
Karen Schneid wants to know, please can you address the question of polio drops? I've heard that many doctors, that it's a prevention. Please can you ask Anton, and thanks to you both for everything that you've done this year.
So no, unfortunately, it's not a prevention. It's the same thought process. People are saying, if you've had a vaccination, immunization against tuberculosis, are you protected? And we're not seeing that. We're not seeing there's this dramatic immune response from being vaccinated against polio. What we are seeing is that they managed to eradicate polio the same way we should be able to eradicate other viruses and other infections. And this is going in the same vein. Remember that the polio vaccine came out, was started in about 1910, but only developed in 1945, so to 1950. So when Sabin and Salk developed those vaccines, it took a number of years. We're now developing a vaccine that has come out, started development from January. We're now in November, they're in phase 3 trials. This normally takes 15 years. So they are operation speed warping it through the States and throughout the whole world with the vaccines. But unfortunately, I don't believe that a polio drop or the TB vaccination is currently helping us with any of these things.
And how is remdesivir working? Because one of our listeners saying that they've heard that it's not as effective as we would have liked it to have been.
So it's very interesting that, because there are lots of studies out there saying it is, it isn't. What we have learned with remdesivir is the sooner you use it in hospital, in the early phase in hospital, in the viral phase, the better of a chance you've got for getting out of hospital quicker. And there's a lot of studies showing that you can use it in combination with other medications. We still don't know, does the anticoagulation, does the corticosteroids, does the vitamin cocktail, all of it work together in enhancing the working of the remdesivir? I mean, they've now come out with a new drug, baricitinib, which is what they call a JAK inhibitor, which is a Janus kinase inhibitor, which works on the inflammatory pathway, that they are advocating that you use together with the remdesivir. So the answer is we would still use remdesivir in the hospital setting with our sick patients, but we try and use it earlier in the viral phase, albeit some studies are showing there's no benefit. We are finding that it is beneficial at this point. We're not finding major consequences of using it. Obviously, you follow up on what the liver functions of a patient are and other markers of the patient, but we would still continue using it.
All right. Dave says, we have kids in Israel waiting to start programs who would love to come and visit us for a few days. Assuming protocols, etc., are followed en route, can you share your view of them getting stuck here from a lockdown or travel perspective? And I think that's a concern for a lot of people, is if we see these numbers go up, people travel here from overseas, they want to get back to a program, is there a possibility that they'll get stuck?
So look, we've got to wait till the president's next discussion with the country, which I think is around the 15th of December, unless something else develops in the interim. And at this point in time, it doesn't look like there's a problem with people getting stuck here. But if the virus goes out of sync and the resurgence, like we've seen in the Eastern Cape, goes amongst all the other sort of provinces, and we get a new wave developing with more than 30% of cases a day, then there's a chance there will be problems. But if you live in a country, you're allowed to travel back to that country as long as you go straight into quarantine. If you're a visitor, it becomes more problematic. They'll still put you in quarantine, but they might stop people from traveling from high affliction or high countries, which are like red zones. So it's a chance you take. We can't predict what's going to happen, but right now there shouldn't be an issue.
Right. There's been a lot of talk around masks, and I've seen this back and forth. There was also some kind of a Danish study in Denmark. Can you reiterate, or can you give us the latest? You know, what was interesting is when we started these discussions, let's say 9 months ago, your initial feeling was you don't need to wear a mask unless you're ill. Then as information started coming out, you felt very, very strongly that people need to wear masks. As far as I know, that hasn't changed, but there's been a lot of talk around this. Can you give us your view on this, please?
Yeah, so as you correctly said, and this is very much in favor of the anti-vaxxers who are loving the study, there's a new study out of Denmark which showed there's no big benefit for wearing masks. Now, take into account this is 1 week after the CDC have updated its guidelines on masks, saying that they're not just for the benefit of others, but they also help people who are wearing the masks from getting sick. So the Denmark study, or they call it the Denmark 19 study, is flawed in many ways, and we're going to discuss that. I think what we've got to realize is masks bring down the community viral load, the community viral spread of the disease. There's less virus getting out into the community, and that means there's less for us as a community to be exposed to if we are wearing masks and other people are wearing masks. The study called the Denmark 19 study tried to refute this and try to prove that non-drug measures such as wearing masks are not beneficial and are actually restrictive to people, and that you shouldn't wear masks. We know mask wearing is considered protective, but this study was done in Denmark in April. So it was done over 1 month period in April in their springtime. And you must remember that at this stage, wearing masks wasn't routine or wasn't even advised by the public health authorities in Denmark or in many countries in the world. So in April, a group of researchers took 6,000 citizens, and they split them into two groups. The first group, they asked them to wear a paper surgical mask anytime they went out of their house. And these masks weren't anything but surgical masks. There was no N95 masks, there was no buffs, there was no cloth masks, there was just that mask. And the second group they sent out were people wearing no masks. Both groups were tested before they went out to see if they had antibodies. And after 1 month, 42 people out of 2,923 in the mask wearing group, or 1.8%, were COVID-19 positive. 53 people out of 2,470 in the non-mask wearing group, at 2.1%, were positive. So why do we say this is flawed? And why does it sound like a wonderful study? It's flawed because it doesn't monitor if people were wearing the masks in the mask wearing group. There's no authority. There's no someone saying, we did wear our masks, we were wearing masks, we were watching you, you were wearing masks, you're putting on the mask properly, you're adhering to other social norms. And in fact, in other studies and other discussions, more than half of the people in the so-called mask wearing group admitted they weren't wearing their masks properly and they didn't put on their masks all the time. So I think a very important point to make is that we must remember that the surgical mask was not invented to protect the surgeon, as we say, but it was invented to protect the patient from the surgeon. So we've got to be very careful of these little studies that come out from countries such as Sweden, Scandinavia, Denmark, these type of countries that originally were letting everyone go free. Because, you know, it can create a false sense of confidence in people saying, well, you know, the studies come out, we don't have to wear a mask, it's not an issue, okay? But they didn't promote hand washing. They didn't promote social distancing, and they didn't promote authoritative care or authoritative people watching over what these people were doing. So we can't have a false sense of confidence if we do wear a mask. That's what it teaches us. In other words, yes, you do wear a mask and other people wear a mask, but you've got to put the mask on properly. You've got to wear it at the right time and all the time. You've got to keep windows open. You've got to social distance, and you've got to keep on washing your hands. And I think to just summarize this whole study, my feeling is it's far better to wear a mask than to wear a ventilator.
Which makes sense if you really think about it. The other thing I think we have to do as a rule of thumb is perhaps throw out anything that comes from the Scandinavian countries. They seem to have lost it completely. You know, Sweden was very much in favor, as we know, of no lockdown. Basically, most of the country died. 12 people that are left now living in Sweden have actually gone, I'm not even joking, they've gone, well, maybe I am about that, but they've actually gone on to lockdown. They're not allowed to gather more than 8 of them at a time this week. So I'm really not sure that anything that comes out of these areas, I mean, for goodness sake, even the minks there, in the mink farms, have COVID. They haven't done very, very well.
I think you're right. And I think we've got to realize that when you look at a study, when you look at it's once again, this is a very much in favor of people who are anti-mask and anti-vaxxers. The science is there. The proof is there. Take it from people on the front line. We've seen it. People who are wearing their masks, especially in a hospital setting, we've seen there's a lack of infections. There's a lack of influenza A, influenza B. We've seen that these things are not transmitted. These non-pharmaceutical interventions work. There is no doubt about it.
It's such an interesting conversation because it's really all about our confirmation bias. And confirmation bias effectively means that we look for things that prove our thought process and we discard everything else. So we could have 90 articles talking about how important masks are, but when one article comes along from some random Scandinavian country where most people aren't even alive anymore, it becomes proof of something. It's a strange thing and quite sad how we've politicized the treatment of COVID-19. As a doctor, you never would have thought, I would imagine, that you'd have stepped into it. Of course, you've always had the fringe, maybe anti-vaxxers, but COVID has really brought this to a fore, hasn't it?
It really has. And once again, you look in the United States and people say it's their right as human beings not to have to wear a mask. I think you've got to take it one step further. It's your right as a human being to protect your fellow human being. It's not a restrictive thing. You can deal with it. You can do with it. We have a right to protect ourselves and our community. We've got a right to look after human life. And looking after human life means following the rules. And it's not hard to follow the rules. Yes, we don't know how long we have to follow the rules for, but as soon as the vaccines come out and they are well established, then hopefully we'll be able to go back to some form of normalcy.
Yeah, and really that's what you're trying to encourage as well. And I think that's important because anybody looking to suggest otherwise, what we are saying, and certainly what Dr. Meyberg is saying, is go on holiday. Don't stop your life. Don't go into a complete lockdown that's going to cause further emotional and other stresses. You've said all along that the kids have got to go to school because that's important to them. But what is critical is that we have a measure of responsibility to ourselves and to our families. A number of people are asking if they are going on holiday and they might be sharing a place with people who they haven't ordinarily lived with during this time. What do you think the protocol should be at least for the first few days of them getting together in that environment? Or perhaps before that, maybe they can isolate in their own homes before that. What's your thought?
I think that would be ideal. If you could isolate in your own home before that for a few days, make sure you're not in contact. Make sure you're not in crowds before you go out. Don't put yourself in a predicament where you could be exposed to something and then you're going to pass it over. Because if that is the case and you are staying with another family and you are exposed, then you and that family together will be quarantined in the house together, which is not a terrible thing, but I don't think that's how you want to spend your holiday. So you've got to be very careful and very, very up to date and very on the ball with all your preventative measures and just make sure you're keeping in control and doing things properly. And you don't just get COVID because you're wearing a mask. It's sometimes because you think you're wearing the mask properly or you think you're doing things properly. You have to do things properly in order to make sure that you can carry on with this normality or this normalcy of life.
Shira wants to know, we've been speaking about long COVID. Are there any treatments, especially for the ongoing fatigue and breathlessness?
So long COVID or acute post-COVID or chronic COVID, and it's got many names at the moment. There's no definitive treatment. I know that in Israel at Hadassah Hospital, they've started a long COVID unit where they're actually looking at getting occupational therapists and psychologists and neurologists together to try and treat the long COVID patients. They do this once they've got a negative result on a patient, so the swabs have come back negative, and after 4 to 6 weeks of getting the actual virus, and they're working as teams to try and work out what is the best way to treat these things. We know the long-term symptoms or the long-term sequelae of COVID are gastrointestinal disturbances, cardiac abnormalities, palpitations, shortness of breath, cough, psychological and trauma related to that type of thing. And that's why you need a whole combination or a multidisciplinary task team to work on this. We do know that there's a few studies showing that you can take vitamin D and that you can take melatonin, but there's nothing out there that's proven itself to be definitive in treating long-term or chronic COVID post-exposure.
And I would just add to that, probably if you are suffering from that, just make sure that your healthcare professional is involved in this and that they are advising you accordingly, because that's obviously absolutely critical. Roanne wants to know, do you think we are definitely going to get a second wave here in Gauteng after the December holidays? Well,
I hope it's after the December holidays, not before. That's our hope. I mean, I don't want a second surge. I don't want a second wave. but there's a resurgence in the Eastern Cape. The numbers are going up and people aren't doing what they need to do. There's a major pandemic fatigue and people just have had enough. So if we carry on like we're carrying on, yes, then we are going to be getting one. There's no doubt about it. What we are seeing worldwide is that the people have understood how to treat the virus better. So yes, there are more people in hospitals, but they're managing to get them out of hospital a lot quicker than they used to. And the people that are sicker aren't as sick as they were the first time. That being said, there still are multiple deaths and there still are things that you cannot control, but there's definitely a better way and a better working task of how to approach COVID-19 now that we are in November 2020.
Gail wants to know, can COVID be spread in a swimming pool and or sea water? And what about if someone with COVID was in a public lift before me and sneezed, for example, is it now safe to get into that same lift?
So look, I mean, this is very important, especially with holidays. You know, you go into a communal swimming pool. You're outside, you're in the open air, but you still got to make sure that your kids or yourself are away from, you can't be on top of people in the swimming pool. Because although it's not as easy to spread in the open air, you don't want to be on top of somebody and they cough in your face while you're in the swimming pool. So keep your distance in the swimming pool, you know, keep your distance in the sea. Obviously, and this is very important, you are not allowed to wear a mask in the swimming pool or in the sea or any water body because that could cause definitive drowning, death, anything like that. So you have to be very careful. And I know it sounds like a stupid statement, but there are people that are zealots and take things really to the highest degree. So you've got to be careful. You've got to make sure that when you're walking to the sea from your beach umbrella, that you don't interact with people if you're not wearing a mask. Go straight to the sea and then come back and put your mask back on. You've got to make sure that when you're in the swimming pool that you just divide yourself and keep yourselves away. What is the last question?
The lift.
So a lift is a bit more problematic because, yes, I mean, if someone's just been in there and they've sneezed and coughed and you're wearing a mask and you're not wearing the mask properly, then it could be an issue. But if you're wearing a proper mask and you're sanitizing it, and we assume that it's within a few seconds of someone coughing, then it's an issue. But the lift opens, hopefully fresh air comes in. I always advocate rather not even use a lift. It's better not to use lifts if you can avoid it. If you can't avoid it, different story. But just keep your mask on tight whilst you're in that lift, and then touch the buttons with an earbud or something else, so you don't have to touch everything and touch all the surface.
And final question, I think the cat might have just scratched me. What were those symptoms for cat scratch disease, did you say?
Hair loss.
And there we have it. It's November the 22nd. I'm Howard Feldman. This has been the Synthesis Sunday podcast. Dr. Anton Meyberg, is there good news?
So there's excellent news. Okay, I think we can understand that the kids have now had a full term at school. More importantly, the parents haven't had to go to any of the end of year concerts. And there are only 10 more school lunches to prepare. So, I mean, that's fantastic news.
Doesn't really get better than that.
And to end with my quote,
of course,
we didn't come this far to only come this far. It's in our hands now. We can do it. We can manage it properly. Wear your masks, social distance, wash your hands. Let's get through the next stage.
I'm Howard Feldman. This has been the Sunday Synthesis podcast. Next week being our final one for the year. Please make sure to subscribe to the YouTube channel. Send us your questions so that we can make sure that we get them answered. In the meantime, stay safe, stay healthy, and wash your hands. Have a great day.